More than 40% of Americans now identify as one or more racial and ethnic groups. As time goes by, this percentage is expected to increase. In 2020, the Census Bureau reported that every 34 seconds, international migration adds one person to the U.S. population. Why is this so important? In order to meet the needs of specific groups of people in the United States, healthcare offerings need to be able to take on different forms. It is essential that healthcare professionals are knowledgeable of the appropriate time to do so. This is where cultural competency comes into play. When health professionals become more aware of their cultural identity as well as their clients, it increases their ability to engage, assess, and treat clients from diverse backgrounds. Cultural competency is defined as the ability to identify both similarities and differences between cultures. An easy analogy to describe cultural competency is putting yourself in another person's shoes. It's about having a broader perspective than your own, and as a result, being able to apply that knowledge appropriately in necessary setting situation. Once achieved, the benefits of cultural competency in the healthcare industry are endless, for patients and industry workers alike. Let's go through 5 benefits of implementing cultural competency into the healthcare industry. The first benefit of cultural competency is that it encourages effective and appropriate communication. Knowing what to say to your clients as well as when to say it will help create a sense of trust between you and your patients. A sense of trust will make patients more likely to open up to you. This means that they're more likely to express any questions or concerns they might be having and wouldn't have mentioned otherwise. By understanding your patients' beliefs, values, and backgrounds, you're able to communicate with them better. The second benefit of cultural competency is improved quality and care. When you're knowledgeable about how to treat specific clientele, you're able to treat them better. An example of this is providing services that specifically cater to a particular population, where people within this group require customized products and/or services to meet their unique needs. The third benefit is that cultural competency helps us to eliminate unconscious bias. In order to be culturally competent, it takes a lot of self-reflection and an open mind toward learning a new pattern of behavior. The truth is that everyone has an unconscious bias, whether we want to admit it or not. An unconscious bias is being unaware that you're leaning toward one side over another due to some type of similarity or familiarity. Examples of unconscious bias in the healthcare industry could be assuming a stereotype about a certain ethnicity and basing your communication with them on that bias, or failing to acknowledge the importance of certain practices a patient follows based upon their religion. When we're able to pick out those unconscious cultural biases and understand where they're coming from, we're able to decrease our prejudices and discriminatory practices. The fourth benefit of cultural competency is that it improves accessibility. Implementing research can give healthcare workers great insight into their clientele and how to better accommodate their wants and needs. To understand how cultural competency improves accessibility, let's take a look at a real-world example. A clinic wants to analyze patterns of broken appointments. The analysis reveals that adolescents have the highest rate of broken appointments. With this information, the clinic can now target specific strategies to help reduce the amount of broken appointments among adolescents. They can do things like adding weekend hours, providing free transportation, and setting up reminder calls from caseworkers. Our fifth and final benefit of cultural competency is more patient participation and engagement. More patient participation and engagement reduces miscommunications as well as language barriers, which can put a limitation on the level of conversation you're able to have. Expressing interest in a patient's native language can help bridge divides. Not to mention it demonstrates mutual respect. Now, I'm not saying that you have to learn every language spoken on planet Earth, but downloading Duolingo to your phone might not be a bad idea. Making patients more engaged goes beyond language. As I'm sure you've heard before, actions speak louder than words. When you're culturally competent, you're able to interpret body language cues, tone of voice, and empathize through active listening, which we discussed earlier with your patients. The healthcare industry simply cannot ignore the importance of cultural competency. Implementing diversity and inclusion training is a great way to make employees aware of different cultures and maybe even more tuned into their own. If you'd like to learn more about the benefits of cultural competency in the healthcare industry, click the link in the description to this video or reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below.